medical scribe, you are following around the physicians and helping to make sure that everything gets documented. Everything from the HPI to the physical exam, making sure things get ordered.
You follow a doctor around and you chart for them. You do all of their documentation, but you also want to help them order labs and do discharge instructions and keep them up to date with the results.
You are basically documenting and transcribing a medical record so the doctors have more time to spend with the patients.
And then at the end, we help the doctors write up a discharge note, and then we dispo the patient, which basically means we send them home. I had heard that being a scribe was basically like the dream job for any pre-med student.
I knew I was interested in the health field, but I wasn't exactly sure that I definitely wanted to apply to medical schools.
I had worked in doctors' offices before, but unfortunately in those settings you're mostly doing front desk and you don't get to really see the interaction between physicians and patients.
The reason I decided to work as a scribe, I have some friends that have worked in the scribe program before. They're currently in PA school and med schools, and they just told me what a great experience this was. I think the most rewarding for me definitely would be working with the doctors and having them right there alongside you.
You spend all your time following around a doctor, which is the best part, and you get to see everything that the doctor sees, sometimes for the first time.
I've probably worked with like 15 different doctors so far and seeing how each of them interact with patients differently.
You get to talk to your attending physician one-on-one. You get to pick their brain about, how diagnoses are made, what labs are ordered, why they're ordered.
Docs are always really responsive and receptive to questions and answering and teaching.
We get to work directly with the attendings. We have a feel for exactly what the doctors are doing. I love working here. It's actually, I loved it so much I decided to do it a little bit longer than I originally intended.
Because it's the best job ever. It's a really good experience. I don't think there's anything else out there that's going to match this because you get to see so much.
You get to see the procedures, you get to see the labs, the orders, you put them in yourself and you get to see the results sometimes even before the doctors see them.
You really see the interaction between patients and physicians, and you kind of learn the thought process of a physician.
If you want to be a doctor or a PA, there's really no better job you can have. My first interview for med school was, I think, 3 or 4 weeks after I started this job. I used, 2 or 3 stories that, from observing what was happening here in my interview, and, I got in.
I mean, this is it. This is the preview of what you're going to be doing with your life.
If you're looking to be a doctor or a PA, it's absolutely amazing.